Well, I picked orthopedic surgery because I've always been interested in surgery as a whole since I was a medical officer and since I was a house officer. And why orthopedic surgery? Well, I felt that it was a lot more hands-on. I could get involved a whole lot more, involves a lot more muscle, a lot more strength. You get to feel things going into place, and you can get a chance to work with certain implants that you would never have a chance with the other subspecialties of surgery. Well, an orthopedic surgeon looks after your bones and joints, so it can range from the spine, from the neck all the way down to the lower back, to the pelvis, the shoulders, elbows, wrists, hips, knees and ankles, and all the bones in between, and joints as well. So if there's any problems, for example a fracture, or if there's any pain in the joints, any swelling in the joints, or any restriction of activity, any function problem, then it may be time to see an orthopedic surgeon. A podiatrist is not a doctor per se. They are, however, specialized in looking after the feet of people, and their sole concern is to look after the general health of the foot in terms of calluses, corns, positioning of the feet, footwear, and various other devices, orthotics as they call them, that they can fabricate to ease the problems that people commonly have with their feet, such as bunions, corns, and various malalignments of their feet. They don't do surgery by and large, and they don't prescribe medicine as well. That will be more for the orthopedic surgeon, and they're part of a team that the orthopedic surgeon uses to treat people with foot problems. Well, I think the main thing for blood clots is the risk of having them prior to surgery. If you have a high risk of having them prior to surgery, then you should be careful before and during and after the surgery to ensure that you don't have any blood clots. So the risks are increased if you have, for example, a clotting problem in the blood, if you have any tumors, if you have a big surgery, a long surgery involving the hip or the knee, and there are multiple factors that come into play. If these are known beforehand, then you have to try and, for one, maybe shorten the duration of surgery. For two, give a bit of prophylaxis. Prophylaxis meaning the prevention of the clot in the blood, and this can be in the form of medication, or it can be in the form of certain devices that help circulate the blood and prevent clot formation. Yes, I do see them quite commonly because I am trained in pediatric orthopedics. Fractures in children are more common than you think. Usually they are mistaken for simple bruises or sprains, but a fair proportion of them actually do have fractures, and this is something that usually is only picked up on the X-ray, and it's also usually missed on the X-ray because children have growth plates, they've got somewhat different looking bones compared to adults, and there can be a little bit of confusion regarding the actual diagnosis, and this is where I come in with my expertise. I'm able to diagnose these things and treat them in an appropriate manner in a timely fashion. I do it by exercising as regularly as I can. Okay, I try to avoid high impact activities as much as possible. I try to go for treadmill, cycling, stairmaster, low impact exercises. I've given up football. I don't really play badminton anymore, so a lot of the heavy sports that involve stop-start acceleration or a lot of impact contact sports, I've sort of toned down over the years, and together with that proper diet and weight control, and possibly some supplements as well, you can control your health quite well. My advice would be to certainly think about it seriously. It's a fun career. I think you can really enjoy yourself if you have what it takes to be an orthopedic surgeon. Certainly the training is long, the hours can be long, and the work can be hard. But at the end of the day, if you have a passion for it, I believe that the feeling of having your patients express their gratitude to you and seeing the satisfaction of a job well done is well worth the effort.